Welcome to this presentation today that will feature the AurumTek digital implant solutions. In this presentation, we'll walk through the step-by-step process, focusing on the various options in our digital implant solutions portfolio, solutions that will help you streamline the delivery of full arch implant retained restorations. Let's jump in. The Aurum Group implant team has amassed years of experience and thousands of completed cases. The AurumTek Digital Implant Solutions portfolio includes all the support you need, starting with our optional surgical planning service. Our stackable guide system has a printed titanium base that can also double as a bone reduction guide. The guides are compact and take up less space in the mouth, and the individual guides connect and disconnect with a unique magnetic system. The system conveniently includes an integrated provisional that attaches to titanium cylinders or to the new EasyPro conversion components from Keystone Dental Group. If your patient comes in with teeth, they leave with teeth. Finally, if you are converting a denture, the EasyPro conversion system makes the process fast and easy without the need for a costly chairside support from a technician, and the EasyPro conversion denture eliminates the need for the time-consuming, messy grinding process while converting a denture to a fixed provisional. The final restoration can be completed in as few as 2 appointments using the AurumTek Full Arch Implant Restoration. Okay, let's get started. In the next slide, we'll walk through the various components of the AurumTek TI stackable guide system with magnetic connectors and integrated provisional. The key advantage of the system starts with the base guide. This very stable compact base guide is made from printed titanium and can be designed to double as a bone reduction guide. If your patient presents with teeth to be extracted, the tooth-borne positioning guide facilitates precise positioning of the base guide. A separate bone reduction guide is optional should you choose not to use the base guide as a bone reduction guide. All guides, including the drill guide, connect and disconnect conveniently to the base guide with a strong, secure magnetic system. Finally, after the implants are placed precisely according to the surgical plan, the system includes an integrated provisional. The screw access holes are precisely located and tiny, making the final attachment of the provisional fast, easy, and with less messing with acrylic at chairside. Now we'll review each component individually. This is the tooth-borne positioning guide used to precisely position the base guide. This image shows the drill guide that precisely attaches to the base guide using the magnetic system. Once the base guide is in position and attached to the patient's bone, the drill guide is securely attached to the base guide with magnetic connectors. After the implants are placed, the clinician will place temporary titanium cylinders or the new EasyPro conversion components that will be used to attach the integrated provisional. Once the conversion attachments are placed, the final step is to attach the integrated provisional to the base guide. It will be securely locked in place with the magnets. The clinician will then secure the provisional to the patient using the retention screws that are torqued as per your implant manufacturer's recommendations. Now the provisional can be carefully separated from the guide and the base guide can be removed. Only one step left. Now it's time to cover and seal the screw holes with a small amount of your chairside resin of choice. As you can see in this picture, the provisional is precisely placed over the titanium cylinders that will be cut down, or of course you can use the EasyPro components. Note that the screw holes are tiny, facilitating easy, less messy final screw covering and sealing with the chairside acrylic of your choice. And here's a final image of the finished provisional now detached from the guide. Next, we'll review an actual case study courtesy of Dr. Michael Klein and Dr. Ellen Waltuck, practicing prosthodontists from New York. In these slides, Dr. Klein and Waltuck will walk us through the process using the AurumTek TI stackable guides with the EasyPro conversion components from Keystone Dental Group. In this case, the surgical planning was completed by Dr. Klein and Dr. Waltuck and sent to the Aurum Implant team for design and manufacturing of a maxillary AurumTek TI stackable guide. These are some of the images from the surgical planning process. This image shows the various guides that were designed, manufactured, and sent to Dr. Klein and Waltuck by the Aurum Implant team prior to the surgical appointment. In the next video, Dr. Klein illustrates the secure nature of the magnetic attachments.
Magnet based, which makes it easy to go ahead and put the parts and pieces in and out and interchange them during the procedure itself. And you can go ahead and see here, how strong the magnet is, but I'll show you in a slower fashion, right, so that you really can get an appreciation of that rigidity. Okay. Right, so here it is.
That's awesome.
You like that?
In this image, Dr. Klein is placing the positioning guide that will facilitate precise placement of the titanium base guide. Now the base guide is in place and the teeth are extracted prior to placing the bone reduction guide. The bone reduction guide is attached using the magnetic connectors, and the bone reduction process is completed as per the surgical plan. Here you see the drill guide easily set in place using the magnetic connectors. The pilot holes are drilled and the implants are placed precisely using the guide as per the surgical plan. Dr. Michael Klein is a practicing prosthodontist from New York. He is also the Chief Technology Officer at Keystone Dental Group and the inventor and designer of the EasyPro conversion system, which is being deployed in this case. Here you see the EasyPro components attached to the multi-unit abutments, now ready for the integrated provisional placement. Once the temporary cylinders are placed, or in this case the EasyPro components, the integrated provisional is attached and aesthetics and occlusal design is verified and adjusted if necessary. Dr. Klein and Waltuck prefer to have their integrated provisional completely hollowed out, since the provisional screw access holes will be drilled later following the EasyPro process that you will see later in this presentation. Here the provisional is adjusted and polished, seated, and the patient is now leaving the office with a new temporary smile. If you are using the stackable guide but do not need the integrated provisional, or placing implants freehand and intend to convert the patient's existing denture, Dr. Klein has designed the EasyPro Conversion Denture. The EasyPro Conversion Denture has breakaway flanges and palate, eliminating the need for time-consuming, messy denture grinding. You simply follow the EasyPro process for attaching the components, then just break off the flanges and palate, adjust and polish the edges, and you're ready to close the tiny screw access holes. Here are some of the steps and timelines required by the Aurum Implant team to complete your surgical planning if required, and/or to manufacture and deliver the stackable guides to your office prior to the surgical appointment. In this next segment, we will walk through the step-by-step process for using the new EasyPro denture conversion system. The EasyPro components can be used for converting a denture or for attaching the integrated provisional from the AurumTek TI stackable guide system. The EasyPro startup kit comes with 10 EasyPro conversion abutments, 6 6mm and 4 4mm EasyPro units. It also comes with 2 12-packs of retraction O-rings, 12 large and 12 regular. The kit also conveniently comes with a tool kit with every instrument you will need to convert a removable denture to a provisional fixed bridge. In this presentation, we will walk you through the use of the toolkit and how to use the system in a series of step-by-step videos. The EasyPro units come conveniently packaged in a sterile pack, and each EasyPro unit comes with a disposable breakaway holder, making the delivery of the components much easier with much less risk of dropping tiny parts during the procedure. Using the hex driver from the toolkit, the first step after removing the unit and holder from the sterile pack is to connect the EasyPro unit to the multi-unit abutments. Once the EasyPro unit is attached to the multi-unit abutment, a small twist of the holder removes it from the EasyPro unit. To capture the position of the implants, a wash of PVS is taken inside the denture that will be converted. Once the PVS is set, remove the denture and use the laboratory burr from the kit to relieve the area of the denture at each location where the denture will seat over the EasyPro components and implants. The startup kit also includes two 12 packs of tissue retraction O-rings, 12 regular and 12 large rubber O-rings. The O-rings retract the tissue and help expose the retention rings on the EasyPro unit. Once the O-rings are in place, use a small amount of PVS to block out the screw access holes. No catalyst is required. Now we're ready to reline the denture over the EasyPro components using your chairside material of choice. When the material is set, remove the denture by gently lifting both sides in a rocking motion to disengage the tie temp copings from the tie temp base copings. In the unlikely event that the tie temp coping is not securely picked up in the reline, just relieve that area for the coping, add reline material, and reseat the denture. No screws are required for this procedure. After removing the denture, it's now time to remove the EasyPro retraction O-rings. These can easily be removed using an Explorer. Voids may be filled using a flow material. The friction fit drill guide may be used as a protection cap to ensure the flow material does not run inside the anodized tie temp coping. From the toolkit, the tall drill guide snaps into the tie temp coping and guides the intaglio drill. The intaglio drill should pass completely through the denture. If the intaglio drill does not pass through the denture, remove the tall drill guide and replace it with the short drill guide, which will allow deeper drilling. Included in the toolkit, the occlusal drill has a smooth drill tip of 1.8 millimeters and is designed to enter the occlusal channel created by the intaglio drill. Using the occlusal drill through the hole created by the intaglio drill will increase the diameter to 2.8 millimeters to create the required diameter of the access hole for the retention screw. The occlusal drill should be used until the wider section meets the occlusal housing of the tie temp coping. After drilling, ensure that the occlusal drill tip is protruding through the tie temp coping as shown in Figure A. it may be necessary to repeat the drilling procedure to achieve the desired result. In cases where fragments of material remain in the screw access channel, it may be necessary to exchange the occlusal drill with the manual reamer to create the base of the screw access channel. After use, it is recommended to use compressed air to remove all fragments. Now place the anodized retention screw inside the screw access channel to ensure correct seating. The tip of the retention screw should almost be level with the tie temp coping. Now it's time to convert the denture to a bridge, removing the flanges and palate areas, being sure to smooth and polish all edges. Remember, the prostheses may be seated intraorally at any time throughout the procedure to evaluate soft tissue contour, aesthetics, and occlusion. The Aurum Group now offers an option. Ask your representative about our convenient breakaway conversion denture. It eliminates the messy grinding of the denture flanges and palate, simplifying and shortening your valuable chair time. After converting the denture to a bridge, it's time to remove the base copings from the multi-unit abutments. Next step, insert the tie temp base coping into the conversion denture. Now the conversion is complete. Time to seat the denture in the mouth and cover the screw holes with your material of choice. For your convenience, Aurum Group will supply a printed chart summarizing the step-by-step process. In the earlier slides, we talked about the Easy Pro conversion denture with breakaway flanges and palate. Ask your Aurum Group representative about the AurumTek Easy Pro conversion denture. To order this inexpensive, time-saving device, simply scan the patient's existing denture and send the data to the Aurum Implant team. The flanges and palate break away easily, eliminating the time-consuming, messy grinding process required to convert a denture to a fixed implant provisional. Once you and your patient are satisfied with the provisional and the implants are stable, designing, fabricating, and seating the final using the AurumTek full arch implant restoration process is easy and convenient and can be completed in as few as 2 appointments. In this next segment, we'll go through the system advantages and the step-by-step process that will streamline your delivery of full arch implant retained restorations. In this last segment, we will dig into what is the AurumTek Nexus technology, why consider this technology for your practice, and how to use the technology in your practice. What tools do you need, and what's the process? The Aurum Group has entered into a co-manufacturing, co-distribution agreement with Osteon Medical, a division of Keystone Dental Group. Together, we have streamlined the delivery of full arch implant restorations, and that's what we're going to talk about in this segment. The system and process is simple, accurate, and fast. Designed to make full arch process completely digital, the Nexus scan gauges enable accurate impressions using your existing iOS with a straightforward checklist and industry-leading digitally designed prosthetic work. In the next slide, the short video talks about the technology, and you'll hear from KOLs using the system.
It's nothing less than revolutionary. Over 12,000 implants restored with this technology. This is tried and true and tested. This is super efficient. I've been doing this 36 years. I can never imagine being able to treat patients this accurately with this type of efficiency.
You're not only delivering a functional result, but the aesthetics on it rival what we do at the highest level.
Shorter visits, because it can be done in literally 2 visits, and being that it's less costly, like photogrammetry, things along those lines, it certainly can bring the cost down significantly to make it better access to care for patients.
If you're not digital in your office and you have a simple intraoral scanner, this is not going to be a big leap of change or a leap of faith. It is very trainable.
You're able to capture the implants in 3-dimensional space, which you're trying to do with all the other techniques, but this is very accurate because of the algorithm that it uses. So you're now going to get restorations that fit passively within 10 microns, which is unheard of. The standard before was somewhere around 100 microns. We don't want to overload the implants. And by having something that passively fits over 4, 5, 6 implants, it just is a game changer.
It is going to change the way dentistry is done in the implant realm exponentially. What Nexus brings to the table is that wow factor that was missing from this type of restoration. Why would you do it any other way? I mean, it's the way to go.
The 3 pillars that make AurumTek Connect the most advanced full arch solution are the scan gauges, the Connect Cloud software, and the Nexus prosthetics. You simply scan, upload, and receive. Every step is made simple digitally. No more impressions, you scan. No more verification jigs. You're going to verify whether your scans are good while the patient is still in the chair. It only takes seconds. And then you upload the data in the software in order. This photo illustrates the steps. First, we do a virtual try-in. Next, we can do an optional printed resin try-in. Some doctors, once they get going with the system, go right to finish from the virtual try-in. And then finally, you'll see a picture of the final prosthetic. The system works with most iOS scanners and most implant systems. You only need an iOS scan gauge kit and a validated intraoral scanner. Every scan gauge kit has a unique serial number located on the top left-hand corner of the component tray. This serial number must be entered or selected when analyzing your scans or submitting an order. Each kit contains 18 scan gauges in varying lengths to accommodate different implant positions. This allows placement in a linking pattern across the arch. 3mm or 5mm cuff heights choices are available to ensure gauges can seat properly on the MUAs. The additional components are to aid with subsequent tissue and existing prosthetic scans. There are 3 narrow scan bodies and 4 scan analogs. Narrow scan bodies are used when implant sites are too close together so a gauge cannot fit. They can also be used during tissue scans placed in the biggest AP spread, or the patient's healing caps can remain. Scan analogs are used when scanning existing prosthetic work extraorally 360 degrees, screwed to the provisional in the greatest AP spread. A unique digital library is created with every scan gauge kit designed for each abutment system. Each library is used to calculate the exact dimension of each gauge and, by extension, the implant positions. Each kit is custom designed with a unique ID built for a specific abutment platform and digital library. Standard scan gauge kits are identified as Universal AA and are compatible with most major industry standard multi-units. Refer to the compatibility chart to ensure that your kit is compatible with your current MUA platform and any future systems you may use. In this illustration, you'll see for your iOS to accurately scan, each scan gauge must be as close together as possible without touching. If any gaps are present, the scanner will introduce stitching errors, which may result in inaccurate data acquisition. Conventional full arch scanning with an iOS is generally inaccurate. Correct gauge placement addresses these problems by providing stable references across the arch. In this scan example, it shows an incorrect gauge placement, resulting in the scanner getting lost with no stable references. When you order your scan gauge kit, our team will teach you how to log into the AurumTek Connect software, and you'll follow the scanning and validation process, then upload your data. Then you'll fill out a virtual script detailing the design of your case. Every step is made simple digitally. AurumTek Nexus restorations require less vertical space, which means less bone reduction required. In the design phase, planning phase, you may choose what style of restoration is most suitable for your patient. FP1, 2, and FP3 designs are available. Scanning is made much easier with cheek retractors. In this illustration, we show the Ivoclar retractor. Let's walk through a summary of the data collection needed. We'll need 2 photos with the existing prosthesis. We'll need you to perform foundation scans on the upper, the lower, and the bite. We'll need tissue scans with the scan analogs in the greatest AP spread. We'll need a scan of the existing prosthetic extraorally. And then finally, we'll need scans of the scan gauges, left to right and right to left. Here are those scans pictorially. We'll scan the upper arch, the lower arch, and the bite. Those are the foundation scans. Then we'll do the tissue scans, the existing prosthetic scan, and the scan gauge scans, left to right and right to left. And here's the photos we need. We need a full face smiling photo, and then a full face retracted. Here's another view of the photos needed. Full face smiling and full face retracted. To get the tissue scans, we'll need to remove the existing prostheses, then scan the upper tissue, the lower tissue. The next step is the provisional restoration scan. Use the provided scan analogs and place them on the existing prostheses, 2 on the posterior implants and 1 on the anterior. Scan the existing prosthetic extraorally 360 degrees. If restoring both arches, repeat for the opposite existing prosthesis. Now it's time to scan the scan gauges. Place the scan gauges on the restoring arch, following the guidance to create a chain link formation without a large gap between the tissue and the top of the gauges. Scan a single arch left to right, save, then scan right to left and save the scans. If you're restoring both arches, repeat for the opposite arch as well. The Nexus scan validation is handled by the free software that's included when you buy the scan gauge kit. Scans are checked for accuracy in seconds while your patient is still in the chair. With the Nexus Connect software, you'll validate your scans while the patient's still in the chair. Once your case is ordered, a design will be sent to your office within 5 days. Once you receive the design, you'll approve the design or send changes. Once the changes are finalized, an STL file can be provided for trying printing at your own office, or Aurum can print the try-in for you. Or optionally, you can choose not to do a try-in and go right to finish. Our implant team can provide you with a 3D printed try-in, or if you're printing in your own office, you can also 3D print your own provisional. We'll send you a design and STL ready for printing. If you choose the optional try-in appointment, you'll use that appointment to check the occlusion, check the midline aesthetics, and ensure that the fit is good, and ensure that there's a proper relationship between the tissue and the prosthetic. After the final design approval and manufacturing, your case will be shipped to your door in special packaging, ready for your patient insertion. Simply scan, upload, approve, and receive. Pictorially, here's what it looks like. First, we'll do the digital virtual design. You'll approve that design or add the changes. Then we'll do an optional try-in, or you can go right to finish, and then in the third picture, you'll see the patient with the finished restoration. And here's some clinical shots of the finished cases. If your scans are done properly, we guarantee that the case will fit perfectly every time. Another shot of the finished prosthetics. The cost of the scan gauge kit in the US is $39.99 and $49.99 Canadian. The cost of the finished prosthetic, regardless of the number of implants, is $49.99 US and $6,400 Canadian. Thank you for your participation in this virtual workshop. For more detail, or to learn more about live workshops, or to get more information, go online to www.aurumgroup.com.